We are still talking about healthcare. This time, the Lagos State Ministry of Health has launched the secondary school eye health program to help reduce visual impairment among pupils in the state. Take a look.
Cataracts, glaucoma and refractive errors are some of the most common causes of visual impairment in Nigeria that could lead to blindness if not treated on time. Cataract tops the list, accounting for 66.2% of blindness cases and 80.7% of severe visual impairment. It's followed by refractive error and glaucoma. In Lagos State, awareness is being created among youths on preventing long-term eye issues with the launch of the secondary school eye health program to detect eye defects early. The first set of students to get tested attend Oregun Junior High School in Ikeja.
The school eye health program is one of the strategies of the Lagos State Ministry of Health Blindness Prevention Program to reduce the burden of childhood blindness as a cause of avoidable blindness in the state. The school eye health program was launched in the year 2006, during which the blindness prevention program team moved around the primary schools on the Ibile basis, the divisions of Lagos State, to carry out eye screening for the pupils. I'm sure I don't need to tell many of you how many students seem not to be doing very well in school, and they seem to be dull students, only to find out that the real problem is that they have a refractory problem and they really can't read from a certain distance. And then once they get eyeglasses, usually that resolves and they tend to do very well. The scope was expanded in 2012 to include training of teachers and installation of vision screening board in all the state primary schools. Till date, the primary school eye health program has reached out to 235,515 pupils and 2,178 glasses have been distributed. A total of 2,002 teachers were trained, 1,001 schools equipped with vision screening kits, and 859 vision corridors installed across primary schools in the state. In a bid to further address the burden of visual impairment and for better coverage, we've started the training of teachers in junior secondary schools as well. This training of junior secondary school teachers commenced last week and will be ending next week. 306 teachers will have been trained and 175 vision corridors would by then have been installed. I think it's also important to mention that beyond the eye health program, the school health program also has a dental component. It has an oral component where oral for mouth, oral for air. AU oral for air, and it also has now a mental health component as well that we're taking to all our schools.
The Eye Health Initiative has trained over 300 teachers on vision screening, while eye screening boards have been installed in all public secondary schools across the state.
We teachers were trained and we were able to detect some students that have serious visual impairment, and today they'll be given glasses so that it will stop them from having more complications.
For the past 4 years, I've been having these eye issues. So my mother took me to a free medical checkup, and they asked my mother to bring some amount of money, but she could not afford it. But I'm here to thank Mr. Governor, Minister of Health, and the commissioners for giving us these glasses to enhance our sight. May God bless you.
The Eye Health Program is one of the strategies of the government to prevent blindness from childhood.
It's important for us to invest in you and to make sure that we're producing the next generation of students that we can rely on to keep Lagos State the center of excellence. It is for this reason that we're introducing these health programs, these screening programs, because eyesight and hearing are one of the most important senses that you can have. Without good eyesight or good hearing, there is no way that you can normally understand what is going on in your schools. And therefore, it's important that we are giving every child, a child can be a genius, but if you can't see or you can't hear, then we're robbing that child of the opportunity, and we're robbing the community of the benefit of that child's genius. For children who have eyesight defects, and that's the commonest form of inability to see or a form of blindness, so we're here to change your lives for those of you that have eyesight defects, so that you can become the best student and that you can bring out all your intelligence and your genius. So I'd like to thank the governor, Mr. Babajide Sanwo-Olu, for driving these programs, and we're going to push them across as many schools as possible to make sure that there are no students that are lagging behind in education and not being able to contribute to the growth of this great state simply because you didn't have access to glasses or a hearing device.
And from the Ministry of Education is a promise of continued collaboration with the Ministry of Health to ensure good mental learning is achieved for students and teachers alike.
Sometimes you find students not performing well in the classroom, not because that child is not intelligent. It could just be a simple problem of refraction. And as parents sometimes, or even as teachers, because of the level of our understanding and enlightenment, we tend to equally add to the burden of that child, maybe flogging that child. You know nothing, you know nothing. Not knowing that, not that that child does not know anything, but because of the distance between that child and the chalkboard. So, eventually it will be now found out that that child has eyesight issue. But today, the Ministry of Health wants to bridge that gap such that we don't unnecessarily burden our students with, our comments of, you don't know anything, you can't see from that place. So when we detect all this early enough, then the intervention becomes easier.
The screening process ends with students who need to correct some eye issues to receive their glasses. Teachers are also presented with the vision screening kits. The next line of action, according to the Lagos State government, is to install vision corridors in all public schools across Lagos State.